I remember his hands on me. I don't remember if they were on my neck, but it was very frightening and insulting and confusing all at the same time.
The pressure mounts for San Diego Mayor Bob Filner as another accuser steps forward. She talks exclusively with us right now on KPBS Evening Edition. Good evening, I'm Eric Anderson. Dwayne Brown is off tonight. For the third time in as many days, a woman has come forward to accuse San Diego Mayor Bob Filner of sexual harassment. This time, it's a San Diego Unified School District psychologist. Morgan Rose met with Mayor Bob Filner when he was a congressman. She says she had to fight him off during a meeting about a national initiative to strengthen families. KPBS investigative reporter Amitha Sharma spoke to Morgan Rose earlier today about her alleged encounter with Filner.
Morgan, how did you come to meet then Congressman Bob Filner in 2009?
I am a school psychologist, and I confront daily the pain of America's children and families. And I recognized that family is our foundation and that we needed to start paying attention in this country. So I founded a national initiative to establish the well-being of America's kids as our highest priority. In 2009, around January, the First Lady came out with a statement that America's children must know that they come first. And with that reflecting of our mission, I contacted Bishop George D. McKinney, a well-known and well-respected San Diegan and very well-known in Washington, D.C., and an advisor on my board. And I asked him, who do you know that can get this mission to the White House? And he organized a meeting with Congressman Filner and our team.
So you had one meeting with Congressman Filner, with other people from your initiative, but then you say the congressman approached you about a private meeting. What reason did he give you?
He phoned me at home, and he asked for this meeting because he wanted to know, in his vernacular, who in the hell you are. And after I got over the abrasiveness of that, I thought, all right, he's needing to vet me before he takes this to the Obamas. So we arranged for a meeting later in the week at Marie Callender's in the afternoon, a public place, directly across the street from his congressional office.
What happened at that meeting?
I gave him my resume because that, to me, was what he was asking for. When I arrived at Marie Callender's, his assistant, Willie Blair, met me and suggested I sit back in a booth. The restaurant, as I remember, was empty. I sat facing the door, and when the congressman came in, he came over, we chatted briefly, and then I explained that I thought the meeting was about knowing me better. So I handed him my resume. He glanced at the first page very briefly and set it aside. And then he told me that he had already taken the mission to Mrs. Obama and that she had requested a memo as to how the campaign would address the escalating violence in America's military families. Of course, I was thrilled to hear this, except then his face just became rather strange, and he was staring at me and then said, "Your eyes have bewitched me." And it was just a surreal moment. I did think about it later in that he was blaming me for what was about to happen. It was my eyes that had bewitched him, that he wasn't responsible for some magical power I had. And then the next thing I knew, he got up from across the booth. He came over and sat next to me, pinning me into my side of the booth, and wanted to kiss me. And I started to ask him, what would your wife say if she was sitting here? And he just laughed this really odd laugh, as if that was the craziest thing he had ever heard. And then he tried to move my face towards his to kiss me on the mouth. And now, listening to the stories of the other victims, it probably wouldn't have been on my mouth, it would have been in my mouth. I turned away and then started negotiating with him. Would you please go back so we can continue this meeting? This is an important topic. And he would say, not until you kiss me. He tried 4 times, and I understand about the Filner neck hold. This was like suspension in space and time for me. It was just so out of the context of my life and my expectation around the mission of the America's Angel campaign that I was negotiating with him, but I remember his hands on me. I don't remember if they were on my neck, but it was very frightening and insulting and confusing all at the same time.
What went through your mind as all of this was unfolding?
What the emotion was that it had been 24 years since I had been physically restrained by a man. And in that 24 years, I have done everything to empower my life that that would never happen to me again. And here it was, out of the blue, with a United States congressman around the mission of the innocence of our children. After 4 attempts to try to kiss me, and me asking him to please go back, please let me out, and he wouldn't move because I wouldn't kiss him, his phone rang, and he stopped, he picked up the phone and took the call and said he had to get back to his office. So he collected the information I had brought about the campaign and left me sitting there to think about, try to make sense of what had just happened.
So Morgan, you're a school psychologist. You've heard about the other allegations, sexual harassment allegations coming from other women leveled at Mayor Bob Filner. As a clinician, what does conduct like this, alleged conduct like this, say about a person?
One of the things I have done in these last 4 years is to write a book to give women the tools to empower their lives. Chapter 18 is on the narcissistic male personality. And on page 193, I list the careers that these narcissistic men will choose in order to position themselves in places of power and to attract women. And as I wrote this chapter a few months ago, I listed these careers, but I saved for last the one that was most important to me, and that was politician. That was the last career I listed. And as I typed that word in, it was all I could do not to just insert Bob Filner.
Morgan, your alleged encounter with the mayor took place more than 4 years ago. Why are you speaking about this now?
When it happened, it wasn't about me. It was about getting this mission forward into the national conversation. And then it was also about writing my book. Now that the book is published, I'm standing for the sisters, the women, and I recognize that the more of us that come out and say what happened to us, and we're seeing the pattern within our stories, the more we empower other women to speak out.
Morgan Rose, thank you for speaking to us today.
Thank you.
KPBS investigative reporter Amitha Sharma talking with San Diego Unified School District psychologist Morgan Rose. Rose also says that Filner's assistant escorted her to the table but did not stay. A state agency has also received a report of inappropriate behavior by the mayor. Our media partner, Voice of San Diego, says the complaint was filed with the Department of Fair, Employment, and Housing on Monday. Now, the agency is not providing any details, but it does say that the person who filed it has requested an investigation. San Diego's Democratic Party leaders will hold another meeting about Filner's case tomorrow night. Last week, members of the Central Committee split evenly on whether to ask him to resign. Filner has appointed his third chief of staff in less than 2 weeks, promoting Deputy Chief of Staff Lee Burdick. She is a former port commissioner, and she replaces Tony Buckles, who was named Chief of Staff on July 15th, the same day that Burdick was made Deputy Chief of Staff. Today's announcement says that Buckles came to San Diego to help Burdick transition into the Chief of Staff post. Buckles was Filner's congressional Chief of Staff, and as such, he was copied on that 2005 email from a political consultant, Laura Fink. That email to Filner was about the then congressman's behavior toward her during a fundraiser in Washington. She said that he touched her inappropriately, and we were the first to bring you her story last night. You can see that whole interview online at kpbs.org. The mayor has not yet responded to the statements by Laura Fink or Morgan Rose. Peggy Pico, however, takes a look at how the mayor and his staff may be dealing with that issue behind the scenes.
Joining me is Beiling Shah, SDSU Professor of Public Relations, School of Journalism and Media Studies. Welcome.
Thank you.
Beiling, allegations of sexual misconduct among politicians is nothing new. Overall, how would you say the mayor is handling these allegations from a public relations perspective?
Well, in a nutshell, not well. The most important thing in public relations is to make sure that your actions match your words. The second most important thing in public relations is to make sure that your words are consistent. And what we've seen in the mayor's response to these allegations is a total lack of consistency. First he says, I didn't treat people well and I have a problem, I need help. Then the next thing he says is, but I'm going to be vindicated, I'm innocent. So that's a problem.
Yeah, and he said he didn't believe the claims in his final statement and that justice would prevail. So some contradiction going on there. Mm-hmm. As more women come forward with allegations, how does this or how should it change the mayor's game plan?
Well, I think what we have to keep in mind is that public relations is just that. It's relationships with the public. And as we all know from our personal experience, relationships are based on trust. So for some San Diegans, maybe they've never trusted this person. For other San Diegans, they might just trust him until the bitter end. So I think what's going to happen as these allegations snowball and more women come forward is you'll probably see more people move from the trusting column to the distrusting column, and it's really going to be up to the mayor and his folks to determine at what point there's a tipping point of mistrust for him to have to go.
Is this a credibility issue? As more come on, then people might think their claims are more credible?
I think there definitely is that, where as more women come forward and you can put a face to the allegations, there is more credibility. And also, as we don't see the mayor responding to the allegations, people are saying, well, why not? Why isn't he? He's giving them more credence by not stepping forward.
Except some of the things that he did respond to, like when he said, I need help, and he was on a newscast that said a few days ago where he was saying that basically there was a monster inside of him. Does that give him any sympathy from the public?
Well, it may have gotten him sympathy right in the beginning when that first statement came out, but then his statements the very next day ruined it. And furthermore, his behavior hasn't really followed up. He said he was going to get help. Has he gotten help? He's admitted that he has a problem. Do people see him around the city treating people differently? Those are the questions that need to be answered.
How would you handle this if you were his public relations person?
Well, as his public relations person, as any public relations person, the key to crisis management is really crisis prevention. So I would like to think that at some point in his long career, somebody on his staff should have said to him, sir, we have a problem here and you ought to get this taken care of. But that's the PR person's job, and it's up to the client to either follow those recommendations or not. And I think what we see here is a situation where the client's not listening, perhaps because that client is in denial.
Where does he go from here? What should happen next? Or resign, come out with more public statements, talk about it? What should happen?
I think that's really difficult for me to say, not being in the mayor's inner circle, but I can say what I would do as a citizen, which is if we want politicians to have words matching their actions, then we as voters also need to have words matching our actions. And by that I mean we talk a good game as voters about wanting clean government, civil government, transparent government. If that's what we want, then we need to vote that way and make our behavior in the voting booth reflect those values that we say we have.
Well, speaking of making ourselves part of this, there's a backlash that often happens when women come forward and claim sexual harassment. What sort of a public relations or public things should they be doing to protect their reputation?
Well, I think what the women are doing who are stepping forward is very courageous. I myself, like many women, have been sexually harassed. I don't think that this is uncommon. So in terms of what these women are doing for their own reputations, there are people who believe them. There are people who respect the choice that they have made to come forward. And there are women out there who continue to suffer in silence, who thank these women greatly for their speaking out.
So they already are, right? Says DSU Professor Bailing Shah, thank you so much.
Thank you.
Mayor Bob Filner was supposed to receive a Lifetime Achievement Award from the National Women's Veterans Association of America next month. After sexual harassment allegations came to light, the organization said that Filner would no longer get that award, but would instead be a keynote speaker at the event. Now, the organization has again changed its mind. KPBS reporter Claire Tregesser joins us with the details. Claire, the organization now says that Filner will no longer be the keynote speaker. Why did they make that call?
Well, the president, Tara Jones, told reporters today she received thousands of phone calls from women veterans and political leaders who were concerned about the mayor's speech. She ultimately decided it would distract from the event's message, which is eliminating sexual assault and harassment from the military. Here's what she said.
It has hurt our organization tremendously as what our overall cause is. And that's why we encourage San Diego to stand before the entire nation and send a message of who they are, and that whatever's going on does not define our city, the largest military installation in the world, that's not who we are as a community.
You can also see that there were some Filner supporters standing there at that press conference. What did they have to say?
Yes, a few people were holding due process for Mayor Filner signs and sometimes interrupted Jones while she was trying to speak. A few of them who told me they are homeless said they support Filner because of his work to support the homeless. Another woman says she's protested at several press conferences because she doesn't think the allegations are valid. Here's what she said.
I am very disappointed that they voted not to let Bob be a speaker, because Bob is still to be presumed innocent until proven guilty.
Filner is still invited to attend the event, which is titled San Diego Mayor's Benefit Gala, and they're not changing the name.
KPBS reporter Claire Tregesser. Claire, thanks.
Thanks.
Our continuing coverage of the controversy surrounding Mayor Bob Filner is online at kpbs.org/news/Filner. A federal report says the shutdown at San Onofre is partly to blame for a power price hike in California. Wholesale electricity prices were up 59% in the first half of this year, but the report says the nuclear plant is only part of the problem. There was also a rebound in the price of natural gas, the state's principal source of electricity. Scripps Health has closed escrow on the former property of the now bankrupt San Diego Hospice. The facility in Hillcrest sold at auction for just over $16 million. Scripps will use it for inpatient hospice care. Deaths from suicides and prescription drug overdoses hit record levels in San Diego County last year. The county medical examiner said there were 413 suicides last year, and the number has been going up since 2006. Today's report also says 269 deaths were related to prescription drugs, the majority linked to Valium, oxycodone, or Xanax. And the medical examiner says alcohol and methamphetamine were equally deadly in 2006. San Diego County Health and Human Services is reviewing the help available to people living in the county who are severely mentally ill and are resistant to treatment. Peggy Pico explores the options in our series on mental health.
Up to 10,000 people throughout the county are estimated to have a severe form of mental illness not being managed. Some families say the county's so-called public safety net has too many holes to help those who are resistant to treatment, resulting in a costly in and out cycle in emergency rooms, prisons, drug use, and homelessness. But there are several service programs in place. Here to explain how they work are James Diego Rogers, Vice President of Clinical Services for the Community Research Foundation, and Dr. Michael Plopper, Chief Medical Officer of Sharp Behavioral Health Services. Welcome.
Thank you. Thank you.
James, the county is recognized for its good system in caring for people with mental illness who are willing to get treatment. But what are the options out there for those who refuse treatment?
One of the main programs is the IHOT program, the In-Home Outreach Team program for those who are refusing treatment or hard to reach. Additionally, the county offers full-service partnership programs, which are still voluntary programs. However, they are targeted specifically for the hardest to reach individuals with serious mental illness and co-occurring disorders who have long histories of homelessness and hospitalizations.
Okay, and part of that partnership, I don't know if you're part of that, Dr. Plopper, but what role does Sharp Hospitals play in treating this hard to reach population?
Well, at Sharp Mesa Vista Hospital and Sharp Grossmont's Behavioral Health Services, we admit about 7,000 people a year. About 4,000 of those folks are admitted involuntarily. The vast majority of them are then discharged back into the community. So these folks had been admitted as a danger to themselves or others, or being gravely disabled.
And by law, just to interject here, you can only keep them for a certain amount of hours.
We can keep them for 3 days.
72 hours.
Yes. A few will go on to a 14-day hold, so we can keep them up to 17 days. But most are either signed into the hospital voluntarily or then are discharged after 3 days. So there are a large number of people who have been admitted to hospitals involuntarily who then are re-enter the community. And our concern is how well they're managed, what the continuity of care is after they leave the hospital. For those people who really can't appreciate the fact that they have a severe mental illness and are unwilling or unable to accept treatment, we have serious issues.
Let's, James, can you respond to that? That you've got this population kind of coming back onto the streets or the communities with no place to go and not willing to get help.
Sure, it's a challenge for sure, and it's certainly something that's quite prevalent. At the same time, with assertive outreach and engagement, especially by including the family members, we are able to reach out and actually convince individuals to start receiving treatment and care for their condition and begin the path of recovery.
So you have an outreach program specifically for these people. I know one option is admission to a locked long-term care facility. I knew back in 1997 there were 3 such facilities in the county. There is now just one with about 150 fewer beds than back then. So Dr. Plopper, how does this impact having this long-term, less beds in these long-term facilities? How does this impact as far as you think this population?
Well, it's had a serious impact on our ability to get people into appropriate levels of care. The IMDs, as they're called, Institutes for Mental Disease, of which Alpine is our one facility in the county, is the only thing available. And as was mentioned, 3 were available a few years ago. So what has happened is we're unable to get many people into Alpine because there are so few beds. We then are left with sending people out of county to locked skilled nursing facilities in other counties in the state for long-term care, and that's custodial care without medication or with medication only.
So these people have to go out of the county to get services, and I know there's a whole lot more to talk about that we don't have time for. But James, I did want to ask you, I know that County Health and Human Services is making recommendations to the Board of Supervisors who are going to vote next week on how to improve or change resources here in the county. What are those recommendations?
I don't know all the specific recommendations, but some that I do know is expansion of the IHOT program, as well as looking at the full array of services that the county network does provide. And through the Mental Health Services Act, I can say that there have been expansions of community-based services that have helped reach out and try to target the hard-to-reach folks through the full-service partnership programs.
Okay, and Dr. Plopper, what would you say about those recommendations or like to tell the Board of Supervisors?
Well, I think the IHOT is a fine program, but we're dealing with a group of people who refuse services and would refuse and have refused IHOT services. And these are people who are potentially dangerous to themselves or others. Laura's Law provides assisted outpatient treatment, so people who qualify, and that is they're recidivistic, they've had multiple prior hospitalizations or incarcerations and continue to be a danger to themselves, can be managed as an outpatient under court order. And it provides a great remedy for this population.
All right, and we'll be talking a lot more about Laura's Law later on in this series, and there's a lot of information on our website, kpbs.org. Dr. Michael Plopper and James Diego Rogers, thank you so much.
Thank you.
Thanks, Peggy.
I'm Judy Woodruff. On the next NewsHour, Senate Majority Leader Harry Reid, plus a program to transform violent offenders into peacemakers. That's Wednesday on the PBS NewsHour.
Our usual summer weather pattern is in the forecast for the next couple of days. It'll be cloudy and mid-70s along the coast, low 80s for the inland valleys with some sunshine. The mountains could get some thunderstorms on Friday, but sunny otherwise. And temperatures in the hundreds for the deserts with some possible thunderstorms ahead. Tonight's stories are online at kpbs.org/evening edition. Thanks for joining us and have yourself a great evening.